Welcome to Headline Buster, brought to you by The Point with me, Liu Xin. In this series, as usual, I'll dissect stories that are making headlines around the world and talk to my guests to compensate for the missing pieces of the puzzle. So, join us in real time by sending us your comments or questions via the CGTN page on Twitter, Facebook, YouTube, or the Chinese social media platform Weibo. If you're watching this live on the CGTN application, you can email us at thepointwithalex@cgtn.com. Let me know what you think. We'll start our live streaming every Friday at 11 a.m. Beijing time, so do get in touch and we just might read out your comments. And the topic this week, the role of the World Health Organization in the global fight against COVID-19. Now, as the number of cases and death row keep rising in countries around the world, anger, fear, and finger-pointing have also proliferated. As of April the 10th, over 1.5 million confirmed cases have been reported globally, and the number of deaths has reached over 90,000. That's according to the Johns Hopkins Coronavirus Resource Center. Different governments have been put under a test, some performing better, others not so well. Yet, instead of looking inward and reaching out, some have chosen to point fingers, not just at China, but this time at the World Health Organization. US President Donald Trump tweeted, "The WHO really blew it. For some reason, funded largely by the United States, yet very much China-centric, we will be giving that a good look." What's the reality? Here are a few key dates to recall. On January the 1st, the WHO set up the Incident Management Support Team, putting the organization on an emergency footing for dealing with the coronavirus outbreak. On January the 4th, the WHO reported on social media that there was a cluster of pneumonia cases in Wuhan. On January the 5th, the WHO published the first disease outbreak news on the new virus, a flagship technical publication to the scientific and public health community as well as global media. On January the 10th, the WHO issued a comprehensive package of technical guidance online with advice on how to detect, test, and manage potential cases. On January the 11th, China shared the genetic sequence of COVID-19 with the WTO. On January the 14th, a WTO official noted in a press briefing there had been limited human-to-human transmission of the coronavirus and that there was a risk of a possible wider outbreak. On January the 20th to the 21st, WHO experts from regional offices visited the city of Wuhan. On January the 22nd and 23rd, the WHO Director General convened an emergency meeting. The independent members from around the world could not reach a consensus on whether to declare an international health emergency. On January the 30th, the WHO declared COVID-19 a public health emergency of international concern, and the list goes on. The WHO has been sounding the alarm the whole way, like a thunderstorm, I would say, but the world decided not to listen. Take a look at this.
This is the time to attack the virus while it is actually manageable, small number of cases in the rest of the world.
We are so prepared like we never have been prepared. But we have done an incredible job. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear.
Meanwhile, infection cases started to spread and death toll started to rise. It was also vital to remember that this is a new virus. New information and data have been evolving every day. So hindsight is always 20/20, as they say, but the WHO was doing the best it could with the information it had at the time. Today, I'll look at one example of how the media can become an accomplice in a politically motivated character assassination of the world's only and most important international public health agency. The Wall Street Journal published an opinion piece by the editorial board on April the 5th. World Health Coronavirus Disinformation. WHO's bows to Beijing have harmed the global response to the pandemic. Now, the word disinformation is a very strong accusation, almost suggesting the WHO corroborates with China to mislead and harm the world. As an opinion piece, it might be dismissed for its stupidity, but as it was written by the editorial board, maybe we should waste a few more minutes on it. Now, the piece begins by trying to paint China as a villain, making it convenient to criticize the WHO for canoodling with China. It selected this piece of information in the beginning that on the December 30th, Dr. Li Wenliang warned Chinese doctors about the virus, and several days later, local authorities accused him of lies that severely disturbed the social order. This could pass for being ill-informed, but excuse me, 3 days early, on December the 27th, other Chinese doctors had already alerted local health authorities of pneumonia cases. By the 1st of January, a special team had been formed by China's National Health Commission to look into the matter. The editorial also says Taiwanese officials warned the WHO on December the 31st that they had seen evidence that the virus could be transmitted human to human, but the agency, bowing to Beijing, doesn't have a normal relationship with Taiwan. By the way, didn't need the Taiwan region to inform the WHO, to warn the WHO of the contagiousness. Doctors were doing that anyway. The WHO, by the way, is a sovereign state member-only organization, and that's why Taiwan can't be a member, not because the WHO bows to Beijing. And this was clearly not a problem in terms of communication for the region. Otherwise, how could it warn the WHO about anything? The region has done fairly okay so far, clearly not hindered by its status within the organization. The editorial piece, echoing some attacks on social media, blames Dr. Tedros for the failings of the organization, saying he's a politician rather than a medical doctor, and that the agency has been corrupted by China's political influence. Evidence? He praised China. Wow, that's how you become political. In March, Dr. Tedros praised President Trump at least twice. Maybe he shouldn't have done that either, because that's political. Now, much hindsight has been cast on the competence of this organization. Honestly, the US is the last country in the world to talk about what could have been done, what should have been done, for obvious reasons. The article says, however, it should have been an easy decision for the WHO Emergency Committee to declare COVID-19 an international public health emergency while meeting on the matter for the first time. It says the WHO head finally made the declaration on January the 30th, losing a week of precious time. Precious time? Maybe to others, but not to the United States, because it did nothing until mid-March. The WHO has to weigh the pros and cons at every step. Too much hurts the global economy. Too little hurts human lives. It's easy to look back and say it could have been done better, but again, not by anybody from the US, either the administration, nor the Congress, nor members of the press. The editorial board concludes by suggesting there is one way to ensure future pandemics are less deadly: reform or defund the World Health Organization. Talking about defunding the World Public Health Organization in the middle of a global pandemic, is that really wise? Or to reform, how? To give the organization more power, less power? The editorial board doesn't really have a plan, and clearly this is a very bad idea at the wrong time. Maybe an investigation should really be launched about how the US has missed all the time they had in their hands. To label the WHO's efforts disinformation is not only scary, but a disservice to the international community when reliable information is direly needed. And you know what? Critics aren't only targeting the WHO, but also making personal attacks on Dr. Tedros. Let's take a listen.
Why would I care about being attacked when people are dying? Because it's personally targeted to me. 3 months in the same situation. But still, they can continue. I don't care.
Unfortunately, attacking international organizations or individuals who are doing their best under overwhelming circumstances doesn't undo the damage governments has inflicted on themselves during this crisis. But I don't want to go into that. There is plenty of coverage out there already. My second example, Al Jazeera on April the 9th published the piece COVID-19, WHO boss calls for honest leadership from US and China. This is a rather neutral piece, I must say. Tedros urges US and China to unite in fight against coronavirus pandemic after Trump threatened to review US funding. The mic is taken away from Trump in this unfolding drama and given to the UN agency to hear what it has to say. And the message is important. The article highlighted Dr. Tedros' message when he said, please, unity at national level, not using COVID-19 for political points. Second, honest solidarity at the global level and honest leadership from the US and China. It also includes significant details that other articles left out, like when President Trump said his country was going to put a hold on money spent to the WHO. It says it was not immediately clear how President Trump could block funding for the agency under US law. Congress, not the president, decides how federal funds are spent, and that the United States is the top donor to the Geneva-based body. US contributions to WHO in 2019 exceeded $200 million, almost double the second largest member state contribution. China, in contrast, contributed $44 million. The article gives the podium to Dr. Bruce Aylward, a senior advisor to the head of the WHO, who said the WHO's work with Beijing was important to understand the outbreak, which was detected in Wuhan in December, and that this critical work is what the agency did with every other hard-hit country like Spain and had nothing to do with China specifically. We've said from the beginning, don't politicize a pandemic. It wastes energy, squanders time, and jeopardizes lives. But if media are complicit in tarnishing the reputation of the world's most important agency for public health, we've got a very dark road ahead. We'll talk about this subject after a short break, and when we come back, I'll have guests to get their thoughts on the controversy and also media's role in covering the story and why media rallying behind such scapegoating helps nobody. My guests will come from Pakistan, the US, and China. Do stay with us right here.
A war without gunfire. The enemy, COVID-19. To contain the virus, Wuhan, the metropolis in central China, grinded to a halt. On January 23rd, its metro stations were shut down, inner-city public transport suspended, and highways closed. It came a day ahead of the Chinese Lunar New Year, dashing hopes of family reunions.
能够了解到，作为一个在外面拼搏了1年的人，每个人都希望盼望着跟家人合家团聚，但是遇到武汉这种事情，那真的是没办法。
Despite the initial shortage of medical workers and supplies, doctors and nurses risked their lives by doing whatever they could in the frontline battle against the coronavirus.
熟手太少了，就经验丰富的一线大夫少了。大部分支援的大夫他还不是完完全全的这个 ICU 的大夫，所以培训呐、训练呐，他还需要一个过程。
Doctors and nurses fought courageously. They're fearless, inspiring, and instilling confidence in their patients.
我是从死亡线上过来的人，这都全部交了医生的。现在的心情特别的激动，能出院了，我觉得哎呀，太重生了。
But some didn't win the battle. Families that bore the loss of loved ones continue to grieve.
有时候还是觉得这不真实，毕竟真的就是你完全就从他走一直到现在，连骨灰盒都没有拿到，脑海里面他就是那种很鲜活的一个人。
As people choose to stay home to reduce the spread of the epidemic, mental health counselors stood by to help those suffering from stress and anxiety.
在这个艰难的时刻啊，我想不只是爸爸您，还有孩子的妈妈，还有孩子自己，都在承受，甚至包括着我们每一个人。 都在承受着这样一个面临一个巨大的这种考验的时候，可能内心中都在受煎熬。
And everyone helped out in any way they could to support the virus prevention and control efforts during the epidemic.
we're making an incredible sacrifice in Wuhan. You can look at the city, it just looks like a bunch of gray boxes made out of concrete. But what's really going on is the personal ties between people.
On March 28th, after more than 60 days of lockdown, Wuhan railway stations welcomed its first batch of passengers. Migrant workers returned to work, while factories and business gradually resumed operations.
回来上班之后就看到大家就感觉，像往常一样了，然后也没有什么过多的顾虑了。
As the COVID-19 threat receded, the city gradually lifted its quarantine measures, and residents are finally able to breathe a sigh of relief. More than 2 months has passed, and Wuhan is slowly returning to being the vibrant metropolis that it used to be. Some people say this is a city of heroes, where its people do not flinch from challenges and fought them head on. It's also a city of everyone pulling together and overcoming one of its most difficult and even darkest moments.
Welcome back, and let's go into our panel discussion. My guests come from Lahore, Pakistan, Mr. Osama Rizvi. He's economic and geopolitical analyst. From Washington, Rick Dunham, our old friend, co-director of the Global Business Journalism Program, Tsinghua University, and Ms. Liu Yungying, associate executive editor and chief commentator of Beijing Review. So welcome to all of you, and thank you very much for joining us on this live streaming in a completely new format. So first of all, let's talk about this organization that's called the World Health Organization. I guess before this pandemic, a lot of people didn't really understand. So what kind of international organization is it, especially the kind of power it has over national government and the relationship that it has with national government? Rick, what is your understanding?
Well, I would consider it like the United Nations. And it is funded by member countries, and it serves the world. And it has both an informational role and a role in terms of strategy and dealing with epidemics, pandemics, and ongoing health issues. There's a lot of data that the WHO releases that's very useful to journalists, to governments, to economists, to policymakers as well.
Yeah, but it seems that from some of the reporting that we are observing at this moment, it seems that there's a certain awakening to the information that was coming out of WHO. Although, as I said, there was a timeline since the very beginning. The WHO has been involved, has been informed, and it has been releasing information as it gets information. So is there a misunderstanding? Is there a lack of focus by the people of the world, by governments of the world, or is it something else? Yungying, what is your impression?
No,
okay, Rick, you first.
I mean, it's complicated, but WHO made some mistakes, particularly tweeting early on of skepticism about person-to-person transmission, and I think it's fair to say that there were mistakes everywhere. The WHO, the local government in Wuhan, the national government in China. Certainly, you've seen it in Europe, and definitely in the United States. I think that when you're talking about disinformation, I think that's crazy. I mean, the WHO may have made some mistakes, but it has never intentionally released bad information.
Yungying, your understanding? Yungying, I don't really hear you. Hello, once again. Just try again. Not now. Okay, let me go to Osama. Yeah, let me go to Osama. Observing from Pakistan, what has been your understanding of the kind of information that was released by WHO and the perception that either it was not doing its job well or it had even bad intentions?
Yeah, there is a lack of context here. First of all, we have to see that China was the first country that has been the first victim of the virus, right? So at the ground, the countries, when they make policies, they have to assess the situation. They don't react, they have to respond, they have to respond. And while you're responding, you have to assess the situation. I'll agree with Rick when he uses the word mistake. Disinformation is a very strong word to use here, and it represents something done intentionally. What was being done for the greater good of the people. And China, China led by example. And if other countries were to learn, they shouldn't have waited for the announcements or any other thing. China closed down Wuhan at only 400 cases, 400 reported cases. So that was as proactive and as vigilant a government could get. And China, was facing this for the first time, and the other countries had time to do. Still, you see, there have been discussions and debates about the lockdown. So I don't see the word misinformation being a fit here. Mistakes, yes, but they come as natural. When you are running a country, you cannot ring the alarm bells just on the first day and cause panic. So that's my point of view.
So how do you look at the kind of motivations or intentions behind the sudden surge of doubts, on the credibility or competence of the World Health Organization, Rick?
Well, first of all, having covered American politics for more than 30 years, this is a presidential election year. Donald Trump has been criticized strongly by not only Democrats, but a lot of people in the public health community and governors for his reactions and his handling of this at a national level. I think he's looking for scapegoats. He started with China, talking about the China virus, the Chinese virus, the Wuhan virus. Now he's trying out the WHO. He's also talking about the American media. You're critical of the American media. Donald Trump has been very critical of the American media, thinking it hasn't given him enough credit. So I put this in the context of trying to shift the blame from Donald Trump and Republicans to anyone else so that he has political advantage.
How do you, Rick, you are very much a journalistic insider of America. How do you look at that this article was written as an opinion piece written by the editorial board of the Wall Street Journal? Right. How much significance is there in that?
Well, the Wall Street Journal editorial board is very conservative. The Wall Street Journal is Donald Trump's. I always separate the editorial page, conservative, from the Wall Street Journal reporters. The Washington coverage of the Wall Street Journal tends to be pretty neutral, but their editorial page is very controversial, and it is very critical of China over and over again, and in this case, and it's very critical of the United Nations and its agencies. I disagree with a lot of the content of that editorial. I think it uses words that are not justified, like disinformation. But it is opinion, and I think that the problem is that it reflects the opinion of the majority of Republicans in the United States, and it definitely reflects the feeling inside the Trump White House right now.
Yeah. Well, it's kind of an unfortunate coincidence, right? Because Wall Street Journal has been very, very famous or infamous among the Chinese readership since the beginning of this pandemic.
Right, precisely.
Yeah, I'm going to Niu Ying for this question because there's been a lot of controversy on that opinion piece that was published on the Wall Street Journal about calling China the real sick man of Asia. And although the author of that opinion piece said it was not his job to put that title there, clearly the editors of that newspaper had a lot of discrepancy, so had a lot of power in making that decision. And now we're seeing such a piece scathingly attacking the World Health Organization and linking that with China. Is this a coincidence? by the way, in your eyes? And we didn't really pick this piece because it was Wall Street Journal, but because of the content and the title of it, and it was editorial board opinion piece. But what is your perspective? Ying, I still can. Okay, now I can hear. Okay.
Okay, good, great. I mean, by publishing an editorial like this, I think it makes the Wall Street Journal look
Okay,
like
the volume is quite low. It's better now. Yeah, try to keep the microphone closer to your mouth.
Okay, good. The point I'm trying to make is that the Wall Street Journal looks like it's Fox News in print now. And I think it's full of disinformation in this editorial because you see it uses anonymous sources from Taiwan, and then it uses a study from the Southampton University because it just used the evidence which can support its argument, but it totally ignored the conclusion of that study. And let me read the conclusion of that study for you. It says, we should show that China's comprehensive response in a relatively short period greatly reduced the potential health impact of the outbreaks. And we need to be smart about how we target COVID-19 using non-drug related interventions. Actually, the study of the University of Southampton is trying to make a point that we need to take such draconian measures to combat COVID-19, such as the measures taken by China, not to make a sense that China should do this at day one, like on January the 1st, because at that time there is no sufficient enough evidence to show that this can be very harmful. This can be a pandemic. There's no such evidence.
Okay, yeah, Liu Ying, you pointed out a very important issue, which is how much how much of a proof or burden of responsibility on the editorial board of such an influential newspaper to write an opinion piece when they have decided to break the rules of journalism and selectively use information or evidence to prove the point that they want to prove. I will go to Osama right after this, but I understand there are some comments from our netizens who have been watching this online, so we'll go to that as we go along. But Osama, let me go to you. Okay, here it is. Here is a comment from Facebook by Steve Karma. It says, my question is, what are these doctors going to do for the poor countries in the world? The big effort, it's on the big countries and no one is talking to the poor countries. So this is another dimension of things. Osama, you want to chip in on that point while responding to the questions about, media responsibility?
Yeah, first of all, regarding the help of the doctors for the poor country, my country, Pakistan, is a developing one. And recently, a team of doctors traveled from China all the way to Pakistan to help us in diagnosis, preparedness, and, finding cure, and, also sent some testing kits. So it is not only that China is helping the rich countries like Italy and others, but also poor countries or developing ones like Pakistan. So it is pretty much the same for all of them.
What do you?
And coming back to your question regarding the editorial.
Yeah, go ahead.
Yeah, sorry. Yeah, coming back to your question regarding the editorial piece. What would have been better? Given the conditions we are in, people are dying. There is no cure. The disease is spreading. So a piece that would have urged all the leaders, the world leaders especially, to come on board and form a joint cell or something, a body that oversees the operations of the fight against coronavirus. That would have been something, better. Not that these scathing arguments against WHO and China colluding with it. Once again, I'd say that this pandemic, and it is not only this pandemic, Lou, it is China's response, which after this is over, and let's hope that is very soon, it will give China much more economic and diplomatic weight, power, and the West naturally perceives it as a threat. Hence the political posturing we are seeing right now.
Yeah, let me.
It's posturing, that is all.
Yeah, well, China's power or progress or influence is already very much under question, under scrutiny, and a lot of people are really fearing that China might use this epidemic or pandemic to gain more power. And this was actually one of the accusations in the editorial piece about the World Health Organization being corrupted by China's political influence. Rick, I want to come back to you. How do you think the media's role can be to help the audience understand, on the one hand, it is true, China is trying to do more, is to be more engaged, is to fund more and, share its experience, have more influence. I would say that is not a sinister thing, for a country to try to strive, especially given the size of China. But on the other hand, it is being seen with a sinister intention and not for a good purpose, but rather for a very, evil purpose even. How do you think the media could really help understand that and not to drum up more fear of China's bad influence?
Well, the first thing I think of, you first use the word accusation, that the world press accused China. I think we should think of it, China shouldn't worry about this as an accusation. It is a reality. China is reaching out to the world. And I don't think you can necessarily control the tone. The best thing you can do, that the Chinese government can do, is control the actions. I mean, there was such positive attention this past week when Jack Ma and sent ventilators to the US and to other places around the world. I think the actions speak louder than words, and I think the best way to counteract accusations is to go ahead and do good things and to reach out. China has an opportunity right now. I mean, I'm sorry to say this as an American, but with the United States looking completely inward right now, with Europe looking inward right now, China is the leading country in the world looking outward to other nations for trying to deal with the pandemic. And if there is some criticism, I think China can weather that. I think that mostly the best thing to do would be to ignore it as much as possible and to keep doing things that win praise in other countries around the world, whether it's developing countries or even from the governor of New York or from media in the United States, with the situation with sending medical equipment. So I would say not to get caught up in name calling back and forth, which I don't think is productive. I think the best thing to do is to reach out, to build ties and to strengthen ties, and just to continue with that.
So that we won't feel so guilty, won't feel so bad for doing what we believe we should do and what we can do at this moment. Okay, that makes me feel better. All right, one last comment coming from the social media. Let's take a look. We might just have enough time to respond to that. So from Rui Jianzheng, whatever who said what, America has 4 months now, still not ready yet. Blame yourself for once, please. Real big American people and leaders. Okay, let me give the final opportunity to Ying Ying. You haven't had much opportunity to speak. What would you like to say? We have talked quite a bit about America having to look into itself for responsibility. But coming from the Chinese side, how do you look at this?
Well, just to continue with Rick's comments, if China engage, we're accused of power peddling, influencing the world, and if we don't engage, we will be accused of apathy, of ignorance of other people's lives. So it's a dilemma. It's a catch-22 situation for China. And for the accusations of why China won't do this at an early stage, I want to say it's very easy to say what we should have been done, what we should have done in retrospect. So every decision is made on the evolving situation. So we need to stick to the facts and report the truth as journalists.
Yeah. Osama, any comment from your side?
Yeah, I would just say that instead of politicizing the virus, what the world community, especially if you talk about the editorial boards of the mainstream media, they should be writing about cooperation, collaboration, and urging every state involved to form bodies and to form teams and to to work together as humans to fight this disease, not politicize the virus as it is happening right now. That will be my final comment.
That's not happening. Actually, I think the sole purpose of this piece was to drive for an investigation by the Congress to look into the conduct of the World Health Organization, whether it is a threat, just to put pressure on the WHO, whether they really intend to do that, to talk about reform of defunding the WHO. I think it is also a catch-22 for the United States if they want to pull out from the WHO or fund less, they will see China's influence or other countries' influence go even further up. They will get nobody else to be able to blame on if in case there is another public health crisis in the future. Well, we have to leave it there. Many thanks to my guests from Lahore, Pakistan, Osama Rizvi, from Washington, D.C., Rick Dunham, and here in Beijing, Liu Yunming, of course. And with that, we come to the end of this edition of Headline Buster. Coming back to this working space environment I prefer much better. How have you enjoyed the show? Continue to leave us your comments and questions. We'll try to read them and think about them at least before we come on the show next time. And with all the team standing behind us, thank you very much for joining us and see you on the show later on The Point.